Break down the diagnosis with Dr. Durrani, an emergency medicine physician, joining us from Houston, Texas. Good to see you again. So just can you walk us through what chronic venous insufficiency actually means in simple terms and why this condition is particularly common in older adults like President Trump?
Yeah, absolutely. So I'll start with biology 101 in humans. The heart is our pump. It pumps the blood, and the arteries take the blood away from the heart. Once the blood kind of gives the nutrients and oxygen to our body, then it returns to the heart in veins. And so, in order for the blood to make progress, we have these valves. So the blood kind of comes up to the heart. The valves make sure that the blood does not seep or go back. When we age, those valves can sometimes become leaky. And so then what happens is that blood kind of pools and leads to things like swelling in the legs.
All right. So obviously you haven't assessed the president personally, but typically in someone of his age, sort of what specific risk factors might have contributed to this, to him developing this?
Yeah, and as you kind of alluded to, this is very common. Millions of Americans over the age of 50 have this. Some of the common risk factors include being obese or overweight. Also, age is a risk factor. Smoking is a risk factor. Also, being immobile for long periods of time. So, if you're sitting at a desk for a long period of time, or if you're standing stationary for long periods of time, that can also lead to that.
Oh,
In addition to that, if you have general kind of vascular disease in your body, that also puts you at a higher risk.
yeah. Okay. So how serious is this then? Should the public be concerned about any complications here?
Yeah, so this in itself is not very serious. As I mentioned, it's very, very common. It looks like they, from what we heard from the press secretary, they ruled out some of the serious things that can cause swelling in the leg. So, for example, leg swelling can be caused by heart problems or kidney problems or really, really bad infections or blood clots. And they ordered the test and ruled out all those really bad things that can cause swelling in the legs. And this would be kind of more in that benign
Mm.
category.
All right. So the job of president obviously involves lots of travel, lots of standing, sitting, and so on. So could this condition affect his ability to handle some of the physical demands of the presidency?
Yeah, so depending on how bad the swelling is, it can lead to achiness, pain, itching feelings, sometimes almost kind of a restless leg syndrome type picture. And so obviously that would interfere with the day-to-day of anyone involved. What I imagine they'll do is use conservative measures to kind of minimize those symptoms so that he can do his job.
Yeah. So I guess that answers part of my question, but specifically from a treatment standpoint, what would you recommend for someone in his position in order to stop it from progressing to something more serious?
Yeah, so what we have for this is what we call supportive conservative measures. And so essentially easing the symptoms. So the most common thing that I'll tell a patient is lift your legs up when you're seated. So maybe you're at home and you put your legs up on a recliner, or when you're going to bed at night, maybe throwing a few pillows under your legs. Those will kind of decrease the swelling. Secondly, putting on compression stockings. That's going to kind of push that blood and fluid, kind of help those valves get that blood back up to the heart. Also, exercise and having a healthy weight, that is very, very important. And then finally, there are some procedures that can be done, but usually we kind of stick to the supportive measures, and that'll ease most patients' symptoms and kind of allow them to do their day-to-day activities.
All right. So bottom line here is, nothing to be too concerned about, but good to get all those details for us. Dr. Durrani in Houston, Texas. Really appreciate it. Thanks so much.
Thank you.